Good morning, everyone. We're going to get started in about 1 minute. So I just wanted to give you all a heads up and make sure there aren't any issues. If you are on your phone, please mute it if it isn't muted already. And if there are any issues or if you have any questions as we're going along, please feel free to use the chat function on the GoToMeeting app. Okay, good afternoon, everyone. Thank you for joining us today. My name is Caitlin McCann. I'm the Vice President Marketing Communications for Mohawk Valley Health System. I will be asking the questions today, and joining me to answer those questions is Dr. Eric Yoss and Sarah Deming from Director of Infection Prevention. So I'm going to let Dr. Yoss introduce himself and give you a little bit of background on what we're going to do here today. And so go ahead, Dr. Yoss.
All right, good morning, everyone. For those of you who don't know me, I'm a pulmonologist and I'm also a administrator here. And I thought I'd start with just a little bit of background. So what we're talking about is a vaccine to the COVID-19 virus, or CoV-SARS-2. It's a respiratory virus. And to start, you have to sort of know what a virus is. And a virus is sort of, I like an analogy, like a posted letter. So there's a protein coat, which would be and also called the viral envelope. And that would be what the genetic material inside the virus is encapsulated in. And you can think of the genetic material being like a letter inside the protein envelope. And the envelope delivers the virus to the cell and injects the genetic material into the cell, and then the cell starts to read the genetic material and making lots more viruses, and then the cell explodes and delivers those viruses to the rest of the body, and it starts all over again. The coronavirus, if you've seen pictures of it, has these little spike proteins, and that's actually what the vaccine is targeted. So this is a new technology for vaccines, and what it does is it takes a fragment of the virus genetic material called messenger RNA, a little fragment of that codes for the spike protein, so the thing in the envelope that attaches it to the cell. And it encapsulates that little fragment in a lipid coat to protect it. And then when they inject that into you, these little things merge with the cells. The mRNA, the messenger RNA, gets into the cell, and the cell starts producing spike protein, which is then read by the body and noted to be a foreign substance. And the body creates immunity to that. And immunity is generated both by cellular immunity, which then works in a certain way, and that activates antibody immunity, certain types of lymphocytes which make antibodies. And that's what they measured during these trials to see if people would create antibodies. And they also looked at during the trials, very simply, how many people got symptomatic disease. That's all they looked at, how many people got symptomatic disease. So the two vaccines that are available, the Moderna and the Pfizer, are very similar. The Moderna is given at first dose and then 28 days later. The Pfizer is given at first dose and then 21 days later. And we'll address the questions about these specific vaccines as we go along. So I'm going to turn it over a little bit to Sarah, who'll talk about just the structure that we're using to give the vaccines here at MVHS. So Sarah, you're up.
Thank you, Dr. Yoss. My name is Sarah Deming. I'm the Director of Infection Prevention, and I have been tasked with organizing and running the pods that we have been holding here on campus. So, as you know, we initially started off over at the St. Luke's campus. We've now moved over to the St. Elizabeth's College of Nursing, who's been kind enough to give us quite a bit of space at the college while the students are out in their semester break. And what we have is a system in place to first screen people when they come in the door, then feed them through to an area where we perform registration. Having people registered in our electronic medical record makes it much easier for us to be able to book follow-up appointments and know how many vaccines we're giving in a day. So we get everyone through registration. They flow into the vaccine area where we have a number of nurses and providers available to administer the vaccine. There are some recommendations both from the CDC and ACIP and from the vaccine manufacturers themselves that because this is a brand new vaccine that no one's ever had before, that there is a potential for an allergic reaction, as there is with any medication that you've never taken before. So we do have an observation area where people go for about 15 minutes after they receive their vaccine. They schedule their second dose, or they schedule their second appointment for their second dose while they're there, and then they leave the recovery area and they're done for the day. So depending on the day, and we've had some variation in throughput time depending on how many people are walking in from the public, but can take generally somewhere from 15 to 30 minutes to get through the pod.
Okay, thank you, Sarah. So a lot of people emailed me questions that they want me to ask either Sarah or Dr. Yoss, so I'm gonna get started with those questions. The first grouping, I tried to group them a little bit so there was a theme, is mainly just general questions about the vaccine. And one that I'm sure a lot of us have heard is it safe? So Dr. Yoss, if you can kind of maybe go through the safety of the vaccine and talk about, the process that was used to create it, and there were a couple questions related to that as far as if it will change our DNA. Can I be infected with COVID from the vaccine? Can I catch COVID from somebody who's had the vaccine? And, talk about the clinical trials a little bit. I know I just gave you a lot, so.
So whenever I talk about things in general and treatments in general, I ask patients, and if we're getting vaccines, we're sort of patients, to think about this in terms of risk and benefit. So there is nothing that you take or do that doesn't have certain risks. Most of you got in your car and drove to work today. You had the risk of having a car accident, but the benefit of being able to get back and forth to work outweighs that risk. So when you look at these vaccines, you have to sort of look at it as what is the risk versus the benefit. Now, there is not a vaccine in existence that doesn't have some risk to it. They all do. And there is not a vaccine in existence that doesn't have some side effects. So the question is, are the risks and the side effects worthwhile to undertake because I get this benefit? So what's the risk of getting infected? So we, everybody who's working in this hospital sees what the risk of getting infected is, with all these sick people in the hospital, people dying. Now, it is true that the older you are, and the more compromised you are, the more likely you are to die. But even children are dying of this disease at a rate that's higher than the risk of having a severe reaction to the vaccine. Plus, if you're out there and you're a 22-year-old and you're healthy, and you say, well, even if I get it, chances are, that I'm not going to get real sick. You may give it to someone, a parent, a grandparent, who then dies from it. And unfortunately, we have seen a lot of that as well with people and grandparents, particularly after Thanksgiving, here in the hospital, very sick, dying because they were exposed by a young member of their family. And it is more likely that a young member of the family will carry the vaccine in an asymptomatic state. So at the time when they reached about 2 million doses of the vaccine, they had 21 severe reactions. So that's 1 in 100,000. Do you have a chance that you're going to have a severe reaction? No one died, and the vast majority of those people went home within 24 hours. So that's, what they consider a severe reaction, and honestly, very, very low incidence of getting that. We in Oneida County happen to be in one of the hot spots in New York State, and New York State has become a hot spot in the country again. So there's a lot of this in our community, and even if you're not exposed here at the hospital, you're likely to be exposed in the community. So in general, the risk of this vaccine is far outweighed by the benefit of being protected against the virus, even in young people. Now, the genetic material which is being introduced into your body if you get the vaccine is a very, very small, tiny fragment of the viral genetic material. So this vaccine cannot give you COVID. You cannot get infected from this vaccine. It's not a live virus vaccine. It's not even a full genome vaccine. So it cannot infect you. So you don't have to worry about that. And I think the articles on both of these trials were published in the New England Journal of Medicine, and they were very, very rigorous trials. And I know there was a lot of concern with the politics that was involved with the vaccine, that they would release it too early, but they had very vigorous looking at this, and they've looked at it very closely after the pods have been started, and about 6 million people, or over 6 million people now, have been vaccinated. And I think given the speed with which they developed this vaccine, it is really very safe. Now, side effects like a sore arm or feeling down after a day, that is there. But I have to tell you that I got my shingles shot, for those of you who are old enough to get a shingle shot out there, and the reaction I had to the shingle shot was far in excess of the reaction I had to either the first or the second dose of it.
Thank you. So the next question has to do with, hopefully later on this year, once the majority of people are vaccinated, is there an anticipated time frame for which we hope to see widespread changes to positive cases?
Okay, so usually when we talk about what Caitlin is talking about there is herd immunity. At what level of immunity in the population will this start to go away? And usually herd immunity is somewhere between 70 and 80%. But just going away is different from the number of cases going down. So the more people we vaccinate, the less people there are available out there to get the disease. So, as this penetrates, I think even the 20, 30% into the population, we are going to see the level of disease hitting the hospital, and the numbers that are published in the New York Times every day go down. Now, one question which really has not been answered is, after you are vaccinated, can you still spread the disease to other people? And let me approach this on the first side. So if you get the disease, can you get reinfected? And the answer to that is yes. There have been very, very rare instances of people who have had the virus once, documented, and then at some point later gotten a reinfection of the virus and shed virus. But the amount of virus they shed is markedly less than the average person during their first infection. So none of the trials that were done on these particular vaccines looked at, can a person be reinfected? Because the way the trials were done is they looked at symptomatic infection. So if we vaccinate this many people, how many people become symptomatic, and when tested, they have the virus? And there was a marked reduction, as you read in the press, about 95% efficacy in stopping symptomatic disease. But what they didn't test is they didn't swab everybody every week to see did they get asymptomatic infection and shed virus. So we do not have the science yet to be able to tell you, if you get both doses of the vaccine, well, it's very likely you won't get sick. Is it possible that you will be able to get a very minimal infection where you could shed some virus? And the answer to that logically is probably yes. The answer logically to will I be as infectious as I was if I had the disease is probably no, you would not be as infectious. But again, that's logic and not the science. The science is yet to come.
Okay, thank you. How long after I get both shots am I protected?
So what the initial trials suggested is that after the first shot, before people got the second shot, between 7 and 10 days, they had about a 50 to 60% efficacy in dropping the rates of infection, now symptomatic infection. Now, they did not see how long, what would happen at 3 months, because if you got the Pfizer, regardless of 21 days, you were revaccinated. And if you got the Moderna, at 28 days, you were revaccinated. So the science on what happens at 2 months or 3 months to my level of immunity, if I only get one shot, no one knows. And that's why in the United States, we have been saying, or the scientists who run the programs have been saying, give everybody 2 shots, because we really don't know what the efficacy is going to be at 2 or 3 months after only one shot.
Okay. And let's see, why do I still need to wear a mask after I get the vaccine?
So that's answered by that same similar answer that I gave before. Because we don't know if you can get a minimal asymptomatic infection and perhaps spread some virus into the community around you, we suggest you wear a mask. Now, as I said, common sense would say you're probably less infectious, but the absolute science on that is not out yet.
Okay. And then what is the difference with the new strain of COVID that's showing up in the UK, et cetera? Are the symptoms the same when getting tested? How do you know if you have COVID or the new one?
All right, so this vaccine has had multiple strains that are different since it started. It's a virus. Viruses mutate constantly. The question that really is important is, does it change what the disease is, or does it change your response to the vaccine? And right now, the only variant that they have identified that they think may change the disease is that the UK variant may make it a little more infectious than the older variant. But so far, from everything I have read, no one thinks that the virus has undergone enough antigenetic shift that the vaccine would not be protective.
Okay. Thank you. So now we've gotten a lot of questions about when do I get the second dose? When do I get the vaccine in general? So I'll go into those. The grace period for the second dose, we talked about 21 days or 28 days. Does it have to be exactly on those days, or is there a grace period, give or take a couple of days from when you got it?
So the recommendation out of the Centers for Disease Control is that you try to get the vaccine on the date you're supposed to for your revaccination. But they have said that there is sort of a grace period, and that's 4 days, up to 4 days before the dose is due, you could get it. After the dose, after you were due, so if you were due today and you weren't able to get it today, they say get it as close as possible to the date that you should get it. And that even if you get it a week or 2 or 3 later, you only still need 1 booster. So you would only get 2 doses.
So a lot of the questions were, so somebody asked if they're planning to leave for the winter, should they delay their travel until they get the second shot complete? And how important is that second shot to get, not miss that, and to get it within the 4-day period?
Okay, so right now, their recommendation is that you get your second shot at the same place you got your first shot. So if you went down to Florida and you only had 1 shot, my suspicion is you would have a very hard time getting that second shot anywhere in Florida, because they're like, people can't make appointments. So when we give you your first shot, we make you an appointment for your second shot. So you are guaranteed to get that second shot. We have reserved vaccine for you, and we have that vaccine, and we have a date when you're going to get that vaccine. So I would very strongly recommend that if you not travel to wherever you want to travel to and try to get the shot there, because with the shortages that are still around, you probably can't. So it is best to get the first and the second shot at the same place. And as Sarah has told you, we make you an appointment for that second shot when we give you the first shot.
Thank you. If somebody had COVID, do they need to get the vaccine since they've likely built up antibodies? And if so, when should they get it?
Okay, so immunity to a virus or to a bacteria is not just antibodies, it's also cellular immunity. And so you should sort of think of immunity as not just being antibodies, it's other stuff as well. The truth of the matter is that no one really knows how long immunity to an actual infection with this virus lasts. For the latest I have read from the experts, they think it lasts at least a year, and some people are saying probably even 2 years. The problem with the vaccine is we don't know how long the immunity for the vaccine will last. It's sort of the same sort of supposition, and it depends on you as an individual and then the vaccine itself. what the CDC currently is stating on their website is that you can get your vaccine as soon as you have recovered from your illness with COVID. All right. There are some extenuating circumstances to that, but that's a general rule. So if you're better at day 10 or day 12, you can go and get your vaccine. What they also say is that almost they're certain that everybody who has the disease, or fairly certain, has immunity at least for 3 months. So you may want to think about that as you're thinking about when to get your vaccine. And the site says something like it would be reasonable to delay your vaccination until that 90-day period, if you so desire. And when people ask me, I tend to tell them, while the vaccine is in such short supply, you should delay it at least for a while to allow the people who haven't been able to get a vaccine to get one. Because if you, as an immune individual, take a vaccine, there may be, some unfortunate 80-year-old dialysis patient who doesn't get one because you've taken it. But you definitely should get one at some point. And I think thinking about that, 60 to 90-day time frame is a good thing to think about.
Okay. See what else we have here. Talk about scheduling. Oh, so if you have an underlying medical condition, what time frame can you get the vaccine? I think they're asking here, what group do they fall into? And maybe this is a question for Sarah versus Dr. Yoss, but if you have diabetes or rheumatoid arthritis or something like that, do you get, but you're say 50, do you get bumped up because of your underlying condition, or is it still based on age?
Go ahead, Sarah.
So it's based on the two of them together, really. So right now it's open to anybody over 75. The next phase that will open up will include people who are over 65 who also have some kind of comorbidity that would make them more susceptible to complications from COVID. So that's the next group that we'll see open up. After that, we will start to see more broader categories open up to those, essential workers who are under the age of 65, who are fairly healthy, and so it'll go on from there. But the state hasn't really given us, number one, either a list of conditions that they would include as compromising, and so we're not really sure yet if that's going to be left up to our discretion or if that'll be dictated by the state. And they also haven't given us a date yet as to when that next group will open up. So 1B just opened up this week. So in the 1A group, it depended on kind of how fast we got that vaccine out to healthcare workers before they would open up 1B. And I'm not sure if that'll be the case for 1C as well.
So I'm going to piggyback on here because I saw a lot of questions about what should people do and think about the vaccine who have immune compromising conditions or drugs. So if you have an immune compromising condition, or you're taking a drug like prednisone or Humira, which may compromise your immune system, you probably have somewhat of a less ability to vaccinate than someone who is not in that circumstance. However, you still will develop some immunity unless you have no ability to have immunity at all, and you would not be alive if that was the case. So the efficacy in someone who's taking, and I'm going to make up some 20 milligrams of prednisone a day, is probably less than the 95 that you see in someone who's otherwise healthy, but it's still something. So even if you have an immune condition or an immune suppressing drug, you should take this vaccine. And actually, since you're much more at risk of getting sicker with the virus, it's even more important that you get the vaccine. And that's why, as Sarah said, the people with conditions that make them compromised are higher up on the priority list than healthier individuals in the same categories.
Okay. So speaking of that, are there any interactions with drugs that people might be taking that we know about?
Yeah, so they think that the reactions to the vaccine are related to polyethylene glycol, which is I think, a stabilizer. in the vaccine, and polysorbate sensitivity, I guess, crosses with that. So if you have a sensitivity to one of those compounds, then you probably should not take this vaccine. You have higher risk. But in terms of like if you're taking penicillin or if you're taking this or that, this vaccine doesn't interact with drugs other than they can suppress your ability to have a brisk immune response to it. So you don't really have to worry about, is this going to interact with the penicillin I'm taking? Now, in terms of other vaccines, they made a general recommendation that if you've had a vaccine, that you wait 14 days before you have this vaccine, just based on they don't want the immune responses to overlap and interfere with each other, because they don't know what the science is if that happens. Though there is a exception there for congregate care settings and people who are very high risk, that can be looked at on an individual basis.
If a person lives in a household with someone who is COVID positive, but they test negative themselves, can the negative person get the vaccine?
So Sarah, maybe I'll punt this to you and let you, I've been talking a lot.
Sure. So one of the questions that we initially had when we started the rollout of the vaccine is whether or not someone who is considered exposed to COVID, who is asymptomatic, could get the vaccine. Obviously, our concern was that a lot of our healthcare workers fall into that category just by the nature of the work that they do. And if we started excluding people who were exposed, there are healthcare workers who might never be eligible for this vaccine, people who are at high risk for exposure, especially on the COVID units. So as long as you are asymptomatic, then yes, you can receive the vaccine, even if you have a known exposure. I will temper that by saying that if you live with somebody who has COVID, that is a pretty high risk exposure. And so we kind of delineate high risk and low risk exposures. We would consider you a low risk if you were a patient in the hospital who was taken care of by a healthcare worker who was wearing a mask and goggles and then a few days later became symptomatic. We would consider that pretty low risk to the patient at that point. But if you're living with somebody, especially if it's your spouse, somebody that you sleep in the same room with, that's a pretty high risk exposure. And so I would maybe consider waiting just a little while if you can, if you happen to have that kind of high risk exposure.
Thank you. So Sarah, while we're talking with you, can you go through the pods a little bit and answer some questions that people have had? They want to know, where is it? When is it? How can I make an appointment? Who can make an appointment?
Sure.
Things like that.
So right now there is one pod site. It is over at the St. Elizabeth's College of Nursing. We initially started off at St. Luke's and then quickly realized that the volume of people that we needed to get through really didn't work well in the space that we had at St. Luke's. So there were a number of space challenges. So since the students are on their semester break, we were able to kind of temporarily move into the College of Nursing, although that won't be our permanent site. We'll be moving from there as well. It's when the college kids come back to school, they'll need that space. MVHS employees don't necessarily need to make an appointment. They can walk into the pod. We want to make it as easy as possible for our employees to get vaccinated. We want to make sure as many of our people as we can are protected. There is what we lovingly call our Easy Pass lane. So if you are somebody who is on the clock and you have to come over to the College of Nursing and you want to run through and get your vaccine, but you don't have time to wait in line, the screeners at the door will give you kind of a green pass, and it allows you to go right to the front of the line so that you don't have to wait. So if you're somebody who's coming in off hours, and you don't necessarily need that fast pass function, you can still walk in. For people who are making appointments other than those who are MVHS employees, we have two ways that you can do that. So one of the primary ways, and this is available to the public, is to use the Department of Health website. And there's a specific link, actually there's a number of specific links that will take you to different pod sites in the area. So ours is one. The Oneida County Department of Health has just recently opened theirs. I believe Herkimer County is opening one soon as well. So there's specific links to each of these, and it will allow you to see what appointment times are available, and you can schedule yourself. Barring that, if you're somebody who doesn't have access to internet, you can call central scheduling. I believe that central scheduling is receiving a lot of calls about vaccines, as you can imagine. And so there might be a little bit of a wait time, but you will be able to get through eventually. Right now, we are not scheduling any additional appointments. So we have a very full schedule for the next few days at the pod, and then we will open up more appointments as we receive more vaccine shipment in. So right now, all of our vaccines are kind of spoken for, which is why we're not taking walk-ins from anybody besides employees. There's probably something else that you answered me that I'm, or that you asked me that I'm forgetting to answer, Caitlin.
So when they go to register, though, I think this is an important thing to point out. It will say St. Elizabeth. There's not a St. Luke's option, and that's because we just have the one.
That's
Okay.
correct. So, you know, I think that there have been some people who have wondered why we're not running a pod at each site like we tend to do with our flu vaccines, and there's a couple of reasons for that. It takes between 25 and 30 people to be able to run that pod every day, and so to duplicate that in 2 spots, obviously that would take an additional 30 people out of the hospital that are currently caring for COVID patients, and so that's just not really feasible at this point. Space is another issue, so there's not really in either of the main hospital buildings, there's not really a great, very big, wide open space for us to be able to accommodate, you know, the number of people that we see. So generally about 500 people a day happen to go through that pod. We've been able to vaccinate over 6,000 people in the last couple of weeks, which has been great. And it works well in a larger space. Fortunately, that means we can get more people through.
Perfect. And then
Sarah, it's Dr. Detralia. I'm sorry to interrupt, but could I ask a question?
sure, go ahead.
Okay. I just have a question about registering. You know, I registered my parents who were both over 75 over the weekend on the website. And of course, at the time, 1B hadn't yet opened. So it was telling me that I didn't have the option of arranging an appointment.
Mm-hmm.
When I go currently this morning, you know, MVCC and College of Nursing are both full. Is it our responsibility? Do we have to keep going on to make an appointment, or by virtue of the fact that they have my contact information, will they contact me to schedule them when there are openings?
No, so right now there's not really a way for us to see people who weren't able to schedule themselves, especially on that Department of Health website. So we don't actually have a whole lot of control over that. You know, we can open up appointments when they're available and we can see who registered, but that's about the extent of the information that we can get out of that particular website.
Okay, so I basically just have to keep going back on, and when positions open, you know, spots open, just schedule them when they get opened is basically
Correct.
what needs to happen. Okay, thank you.
You're welcome.
And just a reminder that anyone getting their second vaccine, even if you had it at St. Luke's the first time, it will be at the College of Nursing.
Correct.
Okay. And Sarah, how long is the wait usually? If, you know, typical.
Yeah, so if you're somebody who comes in and you've got an appointment, it usually takes us a little bit less time to register you because you've done maybe some of the registration process already, especially for your second dose. So the second dose is a little bit quicker to get through than the first dose. You know, I think the longest wait time that we heard over the last few weeks was right around 40 minutes, and that was because we had a lot of walk-ins. Typically on the days that the Department of Health decides to open it up to a larger category, those seem to be the days that we get inundated with people naturally because people have been waiting to be able to get in. So those days, the wait has been a little bit longer. But for the most part, most people are able to go through the pod in about 15 to 20 minutes.
Perfect. And Sarah, can you just give the website real quick of where people can go to get more information?
Sure. So if you're looking for information about where and when you can get the vaccine, or if you're looking for the Department of Health website or link to be able to book yourself an appointment through that website, it's mvhealthsystem.org, and then it's /vaccine-network. And that is a site that we are running through the hospital just to be able to put all of the information out there that we're able to pull together. And so that if things like the Department of Health changes the website that you need to go to, we'll be able to get that information out to people, keep them updated.
Perfect. Thank you so much. Dr. Yoss, we're coming back to you now. Kind of under the heading category of side effects, long-term effects. One question we received is, how do we know what any long-term effects will be?
So let me just talk about the side effects in general. So there are a lot of people who get a sore arm. Okay, so that's pretty common. The question of are there more side effects after the second dose than the first dose? I think the answer is yes, and it should sort of make sense in your mind because the side effects are the reaction to the vaccine. So you get a sore arm because your body's reacting to the vaccine. So when you've had your first vaccine, your body does not have a lot of immunity already. So maybe you're reacting a little bit to the compound that they're giving you directly, the elements in it. And I told you I got my first vaccine and I had, minimal symptoms with my first, and that's what I hear from most people. Second vaccine, since you already have some immunity, you have the ability to develop an immune reaction to what they're giving you. So, my arm was sore, and for a day or two, I felt just a little off. I didn't get real sick, but I've talked to some people who have felt that they were ill enough that they stayed home for a day. Two of the physicians who I spoke to came to work not feeling the best, and after their second shot, and both took a couple Tylenol and a Motrin and were able to work. So yeah, there are some side effects. Now, there's been a lot of questions that I've had personally and that I've seen people have sent in about what happens if you get some redness in the arm and the redness doesn't go away immediately. So if you get some redness, I would expect that can be an immediate hypersensitivity response to something in the vaccine or more of an immune response, but that should fade. It probably will maximize in a day or two, and then it should fade. So if you still have significant redness at the site or swelling at the site a week or two out, you probably ought to speak to your provider about that. Just make sure that you don't have some sort of complicating cellulitis or something else of that nature, because that would be unusual to have that far out. I saw some questions about, should I get it in the same arm? Should I get it in the other arm? Personally, I took it in my left arm because that's my non-dominant arm. And if I got a bigger reaction, I want to be able to use my dominant arm to write and move around and all the things that I use my dominant arm for. So if you have persistence of a lot of swelling and redness, speak to your provider about it. Expect after the second shot, particularly, to get some more swelling than you had after the first shot, to feel a little more run down. And I was speaking to a pharmacist actually over the weekend when I came in to check the clinic, who was saying she was a little afraid to get her second shot. But the answer is, again, risk benefit. You're a lot more risk to have COVID than you are from the vaccine. And even we're not really sure how much efficacy and length of time the one shot will give you. So I think that you're well advised to get the second. The only absolute contraindication to this vaccine is a severe reaction to the first shot or a severe reaction to polyethylene glycol or polysorbate. So if you've had a reaction to a flu shot, if you had a reaction to the single shot, that is not a contraindication to getting this vaccine.
Okay. So a couple people that wrote in were asking about if you get COVID in between the first and second shot. Apparently that's happened in a couple of cases. What's the protocol for then getting the second shot? Does it push it out? What should they do?
Yeah, so if you think about, let's say that the shot is 50% good at giving you protection a week after the first vaccine, that means that you can still get it. Of the 3 people I know who have gotten sick after the vaccine, they all had relatively mild illness, and they called me to ask me what they should do in terms of getting the shot. CDC recommends that as soon as you are back to feeling like yourself, that you can go and get the vaccine as long as you are out of the quarantine period. And the reason for that is they don't want people who are potentially shedding virus to show up at these pods and spread that to other people. So once you're better and you you are ready, then you can come and get the second shot.
Okay. Let's see. We have a couple coming in on the chat. So, oh, here's a good one. I don't think we covered. Maybe Sarah can answer this one. Will there be any change in the rules for quarantine if you're exposed to COVID if you've completed both doses of the vaccine?
So I think we'd look to the Department of Health to make that guidance. You know, a lot of the guidelines that we follow, they're not something that we've developed internally. They're what the Department of Health has kind of directed us to do. So I would be curious to see if anything changes with vaccination. I don't think that it will. You know, I think don't know enough about the vaccine. As Dr. Yoss mentioned earlier, we don't know enough about, you know, how protected you are after one dose versus how protected you are after the second dose, what your potential is to have an asymptomatic infection versus a symptomatic one because you've got less virus in your system, what the potential is for shedding the virus. So I think until that there's better answers to those types of questions, that we won't see any change to the Department of Health quarantine recommendations.
And then I think we covered this a little bit, but you know, how are people with cancer, for example, impacted by the vaccine? I know we talked about immunocompromised people, but maybe if we can just be a little bit specific on cancer patients.
So cancer is a disease that is has a big continuum of what the patients look like and how sick they are, from people having skin cancer to people having widely metastatic cancer of solid organ type like colon or lung, and they've lost a lot of weight, and that obviously impacts their ability to immunize. So what cancer does is it impacts your ability to immunize. It doesn't mean that you're more likely to have a reaction to the vaccine. So if you are severely debilitated and have lost 30% or 40% of your body weight, and your white count is low because they're giving you chemotherapy, your chance of getting a brisk immune response to the vaccine is less. But you probably will have some immune response. And since COVID, if you get it and you're that ill, you're much more likely to pass away from it. It will confer you some protection. And the less ill you are with your cancer, the more likely you are to be able to develop a better immune response. So cancer should not affect your decision to have the vaccine. In fact, it should make you more determined to get it. Now, I saw some questions about pregnancy, and pregnancy is a little bit of a different ball of wax. So let me talk about pregnancy. The live virus vaccines in general are, pregnant women are told don't take live virus vaccines. This, as I told you when I started, this is not a live virus vaccine. This is a fragment messenger RNA. And the question is my immune response, or is this fragment potentially, my body's going to make spike protein, so I'm going to develop this immune response to it. Can that get into breast milk? Can that affect my baby? And what the Centers for Disease Control says is that overall, the recommendation, I think, is to get the vaccine if you're pregnant, because getting COVID can impact your pregnancy adversely. So if you get the disease, it can affect your ability to carry to term and other things with the baby. As you might think, if you become viremic, that can affect the baby. However, they caveat that, as they always do when they talk about pregnancy, is that you should have a discussion with your obstetrician. So, and I think that's very good advice. So, because no one knows your specifics of you and your pregnancy except your obstetrician. So while they can make global recommendations for pregnant women in general, They can't make a specific recommendation for an individual patient because each individual patient is different. So what I would suggest to you, if you happen to be pregnant and are considering should I get the vaccine, is to have a discussion with your obstetrician, recognizing that getting COVID is dangerous to you in your pregnancy and dangerous to your baby, and then look at the risk-benefit profile that your obstetrician discusses with you.
And so Dr. Yoss, while we're on this topic, there's some rumors regarding sterility from getting the vaccine. Some younger people have decided they don't want to get it because they think that they won't be able to conceive or have children in the future if they get it.
So you know, these are like Darlene talks about the rumors of the week. So I have not seen that anywhere in terms of it causing sterility. And just in terms of thinking about what's going on in your body, there's no reason to believe that getting this type of vaccine, whether we put a little bit of viral mRNA to make this spike protein, and then your body making spike protein, and you have an immune response to that, why people think that will affect their gonads more than the rest of the body is amazing to me. And even with the disease, we haven't even heard that if you get a full-blown COVID-19 infection, which you certainly are developing an immune response, because if you don't, you have died. People haven't had sterility from that. So I would say that the chance of getting sterile from this vaccine is probably significantly less than walking out of the hospital today, getting hit by lightning, making it at your house, and then getting hit the second time before you walk into your house. I don't think it's a real concern.
Okay. Thank you for that. We have another question about the second dose of the vaccine. Is it more concentrated than the first?
No, it's exactly the same. The thing that's different is if you are a normal individual, you probably have developed some immunity to it. And that's why you're probably more likely to have an immune response. And just again, to personalize this a little bit, I sort of alluded to the fact that when I got my shingle shot, I had quite a reaction. My arm blew up about twice the size, and I was out of commission for 2 days. But the risk of getting shingles in my age group and older is significant and not very good. So I have already decided, even though I had quite a brisk reaction to the shingle shot, that I will go back and get my second when it's due.
All right. And we're getting a couple questions about allergies, you know, to eggs, shellfish, peanuts, etc. Does this have any impact on people who might have allergies? And well, I'll let you answer that, and then we've got another one.
Okay, so the whole thing with egg allergy has to do with flu vaccine, and that's because they grow the virus in, I think it's, I forget, maybe duck or chicken embryo. I forget which egg it goes on. And so some of the proteins of that egg embryo that they're growing it on get into the shot. And I always get, you know, questions when we give flu shots. Oh, yeah, I'm allergic to eggs. And then I say, well, do you eat eggs? And they say, of course I eat eggs. So I guess you're not allergic really to eggs. The components that were the ones that I talked about, the polyethylene glycol and the polysorbate, there are other things in there which an individual might rarely be reactive to. The mRNA molecule, you're not going to have a reaction, and the lipid, you're not going to likely have a reaction to. So if you have a history of severe anaphylaxis to a lot of stuff, so if you're one of those people who walks around with an EpiPen, and it's not just that you're allergic to peanuts, you're allergic to everything, and you're constantly having anaphylactic-like reactions to a lot of compounds, and you have to use your EpiPen a lot, then, you know, I don't know what the answer is for you. It sort of is, what's my risk of dying of COVID? But that's really an unusual circumstance. So the majority of people who have like peanut allergy, which is a real allergy, or latex allergy, there's no reason to think that they're going to be specifically allergic to this vaccine. I've seen some questions about Guillain-Barré, which has very rarely been associated with flu shots. And honestly, the incidence is in the like 1 in millions. So until we've given this vaccine to, 100 million people, we're not going to know if there's a 1 in 10 million chance that you could get Guillain-Barré from it. But again, the risk of getting COVID and dying from COVID or getting one of these prolonged illnesses, there are these young people who don't die. There have been a large number of them who have gotten these chronic fatigue, chronic illnesses after having the disease. So your risk of getting something like that is significantly more than it is getting the vaccine.
Dr. Yoss, do you have a place that people should go, say they have a question that maybe their primary care provider doesn't know the answer to, is the CDC website the best? Is there a resource that people can go and kind of get information?
Yes, so the CDC website, which I have used it rarely before COVID, and now I use it all the time. They really put their information in a very easy to address and easy to find format, and it's really good stuff. So it's cdc.gov, and then you go to the side where it's like diseases, and you pull up COVID-19, and then they have this thing over the top. I usually go to healthcare provider, because then the language is more directed towards healthcare workers who know what they're talking about. And they have all this whole glossary and a search form that you can go into in terms of finding information. So like even after today, if you haven't gotten enough information on the vaccine, or you had a specific question that me and Sarah and I did not address, then going to cdc.gov and then going over to coronavirus and then the vaccine, you'll be able to find it there.
And then I know one more time, we talked about this a little bit, but drug interactions with the vaccine, is there a place where people can go and look it up, or is it just a general, you should be okay?
Yeah, so if you absolutely know that you're sensitive to certain preservatives or certain things within vaccine compounds, you can look on Moderna or Pfizer and see what's all compounded in that vaccine. If you have like a specific question that I know I'm allergic to this compound, I don't see it listed, can you check that? Then I would go into the CDC site and do a search. But again, the individual vaccines do come with all the things that are in them. And if you know you're sensitive to compound W or something, then you can look and see is compound W in this vaccine.
Do they have a list of drugs that people might be on that might have an interaction, like on the various, like on Moderna or Pfizer? Do they have any of that information?
No, there are no drugs that have been specifically associated with an interaction other than the ability to vaccinate. So people on immunosuppressive therapies, Humira, prednisone, other types of steroid, other types of, tyrosine kinase inhibitors, things like that, that affect their immune response will have potentially a decreased ability to immunize.
Okay, thank you. And then Sarah, I know you kind of covered this a little bit, but we just got a question. When do we think more pod appointments will become available?
So as soon as we get more vaccine in is the easiest answer. So right now, all of the vaccine doses that we have on hand available for first doses are spoken for. So we have a very packed schedule in the next few days between what we've gotten from the Department of Health and then what we've got internally as well. So as soon as we know, we will let you know, I think is the easiest answer.
Okay, perfect. And then for people who want to know when it's their turn, what's your advice if they're not in the current one? Yeah.
Yeah, so the website that I mentioned before, MVHS, is keeping that updated. You can also check on the New York State Department of Health website. They have just released a tool that's called Am I Eligible? And you can find it just by Googling Department of Health, Am I Eligible? And so what that will do is it will ask you a couple of questions about your occupation and your age, and it will tell you whether or not you are eligible at this time, and then it will direct you to some of the sites where you're able to schedule yourself to attend a pod. But I will tell you that, and I'm not sure why yet, we're trying to get it corrected, MVHS's pod is not up on that particular site, but that's a good tool to be able to tell if you're eligible or not.
Perfect. And we will also help push that information out to the media and social media, et cetera, once new groups are opened up. Do you, Dr. Yoss or Sarah, do you have anything that you'd like to add? I think we've gone through most of the questions that people had.
So I just want to add one thing, and as I make my rounds in the hospital and go around and talk to people, there is, I understand there's fear out there. Oh my God, there's this vaccine and it must be terrible. And I think that again, if you just think about this in your mind as a risk-benefit analysis of what's the risk of taking the vaccine versus what's the benefit to me, and not just me, but to my family and other people I might expose, my parents, my children, my grandparents. I think that the analysis here is that if you're in our community now, where the incidence in our community is so high, that you ought to be getting a vaccine as soon as you can.
Sarah, did you have anything to add?
I would echo exactly that. I think that the higher a vaccination rate we can achieve, the better it'll be for all of us. I did just want to mention, and I think that Caitlin, you mentioned this before, but if you've gotten your first vaccine at the St. Luke's campus, please make sure that you come to the College of Nursing on the St. Elizabeth's campus for your second vaccine. Evidently, some people have shown up at the EED looking for vaccines, not necessarily employees, but the public. So the only place that we are distributing vaccines within the Mohawk Valley Health System right now is at the pod at the College of Nursing, and that runs every day. The first appointment is at 9 a.m. And the last appointment of the day is at 3:50.
Now, we did just get one more question about the vaccine being available at the outpatient clinics. Will that happen at any point?
So I believe that's part of the rollout plan for the Department of Health, but again, we haven't gotten those details yet. I believe, actually, Dr. Yoss, maybe you were just speaking about it this morning, that the intention is to get it out to providers who have the ability to store it and administer it in their own offices.
That's
Okay. Well, I appreciate everybody joining. Dr. Yoss and Sarah, thank you so much for answering these questions. Again, if anyone has any more questions that we didn't cover, you can email me at cmccann@mvhealthsystem.org. The website, again, is mvhealthsystem.org/vaccine-network, and that is what we are keeping updated with all of the information. And I hope everyone stays safe. Thank you so much.